Hi, everyone. It's Kate and Zach at Quest Analytics, and we are back with another regulatory review. Zach, there is a lot going on right now. This time of year is always busy. Let's just dive right into what is currently going through a review process, which is the Notice of Benefits and Payment Parameters. What can we expect to see out of this?
Well, Kate, the NBPP, or the Notice of Benefit and Payment Parameters for 2024, it hasn't been released yet. So the language has not been released by CMS yet. And this lays out the requirements that health plans have to meet when offering a health plan on the federal exchange in 2024. But the Office of Management and Budget, which is the first step before publishing a rule, they've notified folks that they have received the rule and they're reviewing it. And we expect that it's going to come out in January of 2023. And we'll see that initial language, and it will be finalized in March of 2023 as well. However, based off of what we've read in this year's Notice of Benefit Payment Parameters and the conversations that we've had at Quest Analytics with regulators at CMS, we have a good idea of some things to expect when it comes to network adequacy in this rule that's coming out in January.
Excellent. Yes, we saw a lot of changes in May. And Zach, two of the items in there were items where they're still going to kind of continue those conversations in this upcoming year. One being telehealth credits, or just continuing to take in telehealth information. The other one being wait times. Does the current proposed rule include either one of those? And if so, are they looking to add any more information or any other further requirements for plans?
I do think that CMS, when we see the proposed rule in January, will include information about telehealth. As you just alluded to, in this year's NBPP, they required health plans to submit telehealth information, perhaps to inform a telehealth credit that was given to health plans participating in Medicare Advantage. And so this would be a 10% credit toward meeting your network adequacy time and distance metrics for a collection of provider and facility specialty types. CMS at the federal level, at the federal exchange level, they haven't committed to that, but they are collecting information, and we might see them offer a similar credit to the healthcare exchange in the coming year. And that would be a really interesting development in recognition of the explosion in use of telehealth services by patients and the ability to use telehealth providers to fill network gaps in places like rural areas and places like that.
If someone is looking to continue to track that information or prepare, do you have any tips for them?
They should absolutely come to our website, Quest Analytics, where we will post the latest information about anything related to network adequacy and telehealth. We're seeing states move in this direction as well. The state of Maryland has proposed a telehealth credit that works a little bit different than what we see in Medicare Advantage. We've seen the Medicaid department in California do a telehealth credit. And we know that other regulators are interested in moving in this direction as well. So it will be interesting to see if CMS through CSIO moves to a telehealth credit for the federal exchange, but we will post the latest at our website and update folks when that comes down the line.
Great. Thank you so much.